Major surges of ICE agents have largely faded from public view, but immigration crackdowns are still ongoing in many communities, especially where there's cooperation with state and local authorities. In Florida, where Governor Ron DeSantis partnered with ICE, there were more than 90 arrests a day earlier this year. And in eastern Tennessee, more than 100 people were arrested in an ICE operation just a few weeks ago. Stephanie Sy looks at a new law in Tennessee that goes further than any other and has critics worried it will cut off life-saving care for children of undocumented immigrants.
Amna, in the spring, the state's Republican legislature passed a law requiring state agencies to report undocumented people to ICE if they receive benefits. Many of these families, ineligible for Medicaid or other insurance, have been turning to a last resort state special services program for their kids' medical care. According to the Tennessean, earlier this month, about 400 families received a letter informing them that they will have to disenroll from that program by the end of this month or have their status reported. Michele Johnson is executive director of the Tennessee Justice Center, which is raising alarms about what may already be happening to these children, and she joins us now. Michele, thanks for joining the News Hour. I understand this amounts to a relatively small number of children, but I understand they're some of the most vulnerable: cancer patients, those that need ventilators to breathe, and those with disabilities. The law does not kick these kids off the program, though I have heard that was on the table at one point. So what does it do, and what are the practical impacts you're concerned about?
Well, the letter gives mothers an impossible choice. It says you can either willingly disenroll from this program, that is your only pathway for your child to get life-saving care, or you can stay on the program and we will turn over your information to ICE, which mothers know means that these children could be deported could be detained in things like Alligator, Alcatraz, where they not only won't get the care they need, but they won't even get nutrition. So, I mean, the choice that these mothers have is impossible. And both of these choices lead to, according to doctors in our state, almost certain death for these children.
Alligator, Alcatraz, of course, the detention facility in Florida. Michele, are you already hearing about families who are afraid of being deported, unenrolling in the program? And do you have examples of pediatric patients that may already be losing access to critical care?
Absolutely. We have been talking to families for the last 2 weeks, families who are on the road to citizenship, who have done everything, followed every rule, and received this letter and are scared. You know, that we've created an environment in this country and particularly in this state that is terrifying for people. And so a client that we talked to yesterday has already disenrolled, and her 10-year-old with severe spina bifida who needs surgery in order to not be in pain, they had to cancel the surgery. The provider canceled the surgery. So he is now in unnecessary pain. And I can't really imagine as a mother watching your child suffer, not because of a serious illness that they're born with, but because the elected officials in your state want to have a political issue that they can run on. And that's what this comes down to. It's choosing politics over the lives of these children.
Well, speaking of politics, one of the law's proponents, Republican Mark Corcoran, has been quoted in local press as saying this law, quote, ensures Tennessee public benefits are reserved for those legally present in the U.S. and directs appropriate referral to ICE, while fully upholding all federal mandates for emergency and life-saving care. You just gave that example of the child with spina bifida. Is it true what he says, that this is children still have an alternative? What is your response to his comment?
Well, I've done health law for poor children for the last 32 years. And the emergency room does not address the health needs of these children. There is a law that says if a child is on death's door, the hospital must take them in and stabilize them. But we have kids with cancer, toddlers with cancer that need chemo, and the emergency room will not provide chemo. That is not something that they have to do. And I know this because I've been trying to get health care for children over the last 32 years, and that's not part of the law.
It's supposed to go into effect on July 1st, and we should note that we did invite the state health commissioner to join us, but he declined. What is your organization doing right now to help these families?
First and foremost, we're letting the public know that this is being done in their name with their tax dollars, and we're asking them to call the governor. The governor has said he's a faith-filled man, and I can't fathom that he intended to sign a bill that would do that to these most vulnerable angels in our state. Second, we're preparing to file suit. We will file suit in short order because it's illegal. It's not just immoral, but it's illegal. And last, we're working with families to figure out, is there any way to get any benefits, even some benefits, donated? But the fact is their healthcare is so complex that even if they can get part of their needs met, they cannot know that they'll be safe. We're the only state doing it because Stephen Miller told our head of our house that this was something that would curry favor with the public. The public that I talk to on both sides of the aisle say killing children does not reflect our values, and we're better than that. I really hope the governor will take a second and live out his values.
Stephen Miller, of course, a chief advisor to the Trump administration and one of the architects of its immigration policy. That is Michele Johnson with the Tennessee Justice Center joining us. Michele, thank you.
Thanks for having me.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.